Now I request Dr. Tavish Gupta. He is going to present Hemi retinal vein occlusion following TTT for small choroidal melanoma.
Good afternoon. I am Dr. Tavish and I will be speaking about hemiretinal vein occlusion following TTT for small choroidal melanoma. So presenting a 30-year-old male who complains of right eye diminution of vision, which was insidious in onset and gradually progressive for the past 2 months. It was painless and associated with floaters. There is no other significant history. On examination, the best corrected visual acuity in the right eye was 6/12 and the rest anterior segment was within normal limit. On fundus examination, we can see that in the right eye, there is a raised hyperpigmented lesion just above the optic disc and it is associated with orange pigmentation. Now on ultrasound, we can see that there is a choroidal mass seen superior to the disc with an apical height of 2.2 mm and a largest basal diameter of 6.3 mm. So the two main differentials which we have are choroidal melanoma and choroidal nevus. But we tend to lean more towards the choroidal melanoma due to the orange pigmentation, the thickness and the ultrasound findings. Shields et al. have given us the high-risk features predictive of growth. And in our patients, we saw that 6 of these features were present. And this also points towards choroidal melanoma as the diagnosis. Now, according to the COMS, based on the dimensions of the lesion, our patient had a small choroidal melanoma. And for treatment, the patient was not willing for observation and wanted some intervention. So laser photocoagulation can be done, but it has a high risk of vessel occlusion and collateral damage. Photodynamic therapy also has issues related to the dye and maintaining light precautions. The location of the lesion precluded plaque brachytherapy, and EBRT and gamma knife are associated with radiation-induced complications. Now, transpupillary thermotherapy can specifically target the tumor and causes less collateral damage. And it has been used in the treatment of choroidal melanomas, especially small posterior choroidal melanomas, which are nearer to the critical visual structures, such as the fovea or the optic disc. So we went ahead with 2 sittings of transpupillary thermotherapy, 1 month apart. And 1 month later, the patient gained visual acuity of 6/9 and the tumor regression was also present. But 2 months later, he again had diminution of vision in the right eye with the visual acuity dropping to 6/12. And on the fundus, we can see that in the right eye, there is a neovascularization and fibrosis at the site of the choroidal mass with dilated tortuous vessels, superficial hemorrhages, and sclerosed vessels. This is only seen in the superior hemisphere of the globe, and this points towards the diagnosis of hemiretinal vein occlusion. Now comparing the pre and the post treatment images. In the pre-treatment image, we can see that there is an anatomical variation of the superior retinal vein, in which the two branches, instead of meeting at the superior part of the disc, they are meeting above it over the tumor, and then a single retinal vein is entering. Now in the post-treatment, we can see that there is an occlusion of this anatomical variation, and this is most likely the cause of the hemiretinal vein occlusion. Now under fundus on fluorescent angiography, we can see that there is a regressed hyperfluorescent region with hyperfluorescence from the neovascularization, CNP areas, and block fluorescence from the hemorrhages. On OCT also, we can see that macular edema is present. Now TTT has a lot of complications, and branched retinal vein occlusions have been described as a known complication of TTT. Retinal vein occlusions usually occur due to the compression of the retinal vein at the AV crossing by the thickened arteriole. But after TTT, it does not occur due to that reason. It occurs due to the temperature raise causing endothelial thrombosis and occlusion. Now various studies have been done, and they have given us varying percentages of vascular occlusion following transpupillary thermotherapy for choroidal melanomas. And for these patients, for management, anti-VEGF can be given, or a combination therapy with anti-VEGF and laser photocoagulation can be given. In our patient, as we had macular edema, neovascularization, and CNP areas together, we decided on a combination of anti-VEGF and laser photocoagulation. And over the course of the treatment, we can see that the tumor has regressed, and the NVs have resolved, and the retina is well lasered, and the vision also improved to 6/9. So TTT is a viable treatment modality for small choroidal melanomas, and RVOs are branched retinal vein occlusions are known complication of TTT, but this is a rare case of hemiretinal vein occlusion occurring due to the anatomical variation seen in the patient. Thank you.
Thank you, Dr. Tavish. Yeah, it's a good case, and very well documented. The Optos photographs are really very nice.